This is my grandma Patty, who while suffering from Alzheimer's was asked to give a routine urine sample at a doctor's visit to screen for a urinary tract infection. We didn't think anything of this common test, but what we didn't know is that she was unable to provide a good sample and her UTI diagnosis was missed. Over the next few weeks, my grandma developed sepsis and unfortunately passed away. Why did this happen? Could it have been avoided? In order to properly diagnose UTIs, it is important to follow a specific set of instructions called the clean catch procedure. First, a patient washes their hands and opens the kit containing a cup and wipes. Then, they clean the inner folds of the genitalia with the wipe at least 3 times. After that, they begin to urinate into the toilet and then move the cup into the urine flow to collect the sample. This can end up being a cumbersome process, and oftentimes, patients are not instructed on how to complete it properly. Even when informed, patient noncompliance is high, which results in contamination rates of up to 30%. Sample contamination usually comes from bacteria on the skin and urethra, which are caught in the first 15 to 30 milliliters of urine, also called the forestream.
The clean catch process is already frustrating for many, but problems are exacerbated in elderly patients due to their physical and mental constraints. You see, Mackenzie's grandma is not alone, as 1 in 7 adults over 60 years old in the US experience a UTI at least once a year. Elderly patients, healthcare providers, and family members that care for them need a solution that simplifies the clean catch procedure while decreasing contamination in urine samples.
Introducing the Easy Peasy, a urine collection device that captures and seals away the forestream of urine. This device not only simplifies the clean catch process, it also eliminates opportunities for non-compliance that can cause misdiagnosis. The Easy Peasy utilizes hydrogel technology to absorb the forestream and seal it under a buoyant plate. It begins as a single compartment container that can be opened by a sliding lock. As the user begins urinating into the device, the forestream flows under the plate and is entrapped in the hydrogel and makes it swell. As the swelling increases, the plate will rise until it hits a rim that seals the bottom compartment, and a second compartment containing the midstream that is uncontaminated on top. The device can be closed with a slider lock. The seal is watertight and will prevent leakage during transport. At a testing facility or doctor's office, a technician can simply reopen the lock and access the midstream sample with any urinalysis device.
Easy Peasy's ergonomic design is easier to grip, open, and close than a traditional collection container. It can be easily popped open and held for sustained periods of time by people with arthritis or other dexterity constraints.
Very easy to hold and easy to open. I like this much better.
The Easy Peasy will help geriatric patients maintain their independence in the bathroom while reducing the cost of UTI testing and preventing misdiagnosis.
To assess how well the sealing mechanism functions, red dye was dissolved in water to represent the forestream sample, while undyed water was used to represent the midstream sample. To quantify the separation, a sample of each of the compartments was taken and each solution's absorbance was measured. Using Beer's law with the following standard curve, the absorbance values of the 2 solutions were correlated with a concentration. These concentrations were compared to one another to assess the degree of mixing between the 2 compartments. The Easy Peasy is able to decrease sample contamination to 4.29%. It is also important for Easy Peasy to be easy to open to simplify the handling process for geriatric patients. We used a force gauge to measure the amount of force needed to slide the lock into the unlocked position and open the cap. The slider requires less than 5 newtons of force to open and close. This is the same amount of force you apply when turning on a flashlight for reference.
Diagnosing and treating UTIs are costly, as exams can cost you $80 per test. With the reduction in contamination that our device offers, we can bring this testing cost down to $2.9 billion. To evaluate the market, we multiplied the prevalence rate of UTIs for each population with the average cost of a urine collection device, which is about $1.58. On a global scope, the total available market for our device is approximately $237 million. Looking at just the US, we estimated the serviceable accessible market to be about $57.6 million. Since our device is intended to be used by geriatric patients, we arrived at a serviceable obtainable market to be about $13.3 million for this population.
The Easy Peasy will improve the accuracy and timeliness of UTI diagnosis. This eliminates the cost of repeat testing and the cost of hospital stays in cases of sepsis. Urine collection should not be such a hard and frustrating process. Let's make collection a breeze so UTIs can be diagnosed with ease.